as an international nurse who wants to relocate to the United States of America, you need to have an agency. Of course, I also used an agency. You will have to apply with several agencies, and after your application is accepted, you have to undergo a vetting process to ensure you are the right fit to this agency. And this will be done through an interview, either via Skype, via Zoom, you name it. And if you want to know more about this topic of healthcare workers relocating to the United States of America, stay tuned. If you're new here, my name is Mariontina and I'm a full-time practicing nurse in Phoenix, Arizona. I moved to the United States of America in 2019, and there are so many international healthcare workers wanting to relocate and practice in the United States of America. So I created this channel to pass information that can help foreign educated healthcare workers with information around immigrating to the United States of America and practicing their profession. If you're not subscribed, please do hit the subscribe button. Please do share, like, and don't forget to comment on the topics you want me to talk about. So let's get into the video. The purpose of the agency interviewing you is to gather more information in regards to your educational background, your work experience, your certification. This will occur, as I said, once you've made an application and your agency accepts the application and see, like, you know what, this is a person, or this is a nurse, or this is a healthcare worker that we might consider working with. Then they'll schedule an interview with you. As I said, this interview can occur through Skype, WhatsApp, and all these digital. On the day of the interview, what would I tell you to do? I'll just say ensure you're in a quiet place with minimal to no interruption. Prior to that, confirm that your app is working by doing a pre-test before the call day. And importantly, ensure you have a reliable internet source, because you will need internet connection. Again, give yourself ample time, between roughly 30 minutes to 1 hour, and this will be depending on the agency. Go through your resume, because most of the time it is that most of the question will come from. Do some research on common question asked, just to be ready on this agency to help you have some question on their way of making the process more efficient for you as an individual. Finally, dress up professionally, be confident, and prosper. So I'm going to do this video according to questions that I was asked, or that I've had personal experience with, on how they do their question or how they do their interview. This will vary from unit to unit. You don't expect the same question, the same clinical questions probably in med-surg will be asked in dialysis, or will be asked in cath lab or labor and delivery, and vice versa. But some questions are common, like some questions are common and cut across the board. So we are going to talk about those ones, and then after that I might talk about some of the clinical questions of med-surg, just here and there, like to have a clue, like, you know, this is how my interview can go. As I say, give yourself enough time, because the outcome of this interview depends on so many things. So let's get started. So what are these common questions asked in an interview? The first question that always is asked, tell us about yourself. Do research on what you want to say about yourself, but I'll say my name, of course. I'll say my professional title, my years of experience, the unit I'm currently working, and how I will be a great fit for this organization. Like I just summarized, that is, tell us about yourself. Again, these questions are randomly placed. They're not sequential, like this after this after this. The next thing they'll ask is about your hospital, whether it's a government hospital, a mission, or a private hospital. What is your hospital capacity? What is your bed capacity? What is your patient ratio? This is important. When you say, for example, my hospital capacity is 450 beds, make sure when they go to the internet, because you're in the era of internet and information is so accessible, make sure that that is what they will get on the internet. You can't say, if you're not sure, I'm not sure with the bed capacity at my hospital, I know it's 500, but if I'm going to do an interview, I'll go to the internet to make sure I have the exact number as it's displayed in the internet. If you're going to say your unit bed capacity is 30, right? And then you are asked, what is your patient ratio? Let's say like you go like 6, and then they ask you, and how many nurses are you in a day, in a shift? Then you go and say 3. Mathematically, that doesn't make sense, because if the bed capacity in your unit is 30, right? Then you are expected to have 5 nurses if your ratio is 6. So make sure this makes sense to you. And if you don't do the primary care nursing, just be honest and tell them we do the team care nursing and we get to have 3 nurses in the floor for these 30 patients, or we get to have 4 nurses in the floor, and we spread the work across board and we know who is responsible for this and who is responsible for this. So typically you don't have a patient ratio because you're doing team nursing. Don't say you have a patient ratio of 8 and when you're asked like how many nurses are you, and then you say 5. Like, do the math, okay? That is what I'm trying to say. Like, make sure it makes sense. And most of the time if you're doing team nursing, it's fine. Just that you're doing team nursing doesn't make you less of a nurse. Another question that you will be asked, tell me about your typical day at work. You will start by the time you're reporting, how you get report. Once you get report, how do you plan your day? What do you do first? And all that. You know how your day is. Like, I'll say, for example, when I get to work, I report at 7 p.m. Once I get there, I go to my normal meeting or adult. Once we are done with the adult, I'll come back for my report. Once we do the bedside report, of course, when you do the bedside report, you'll have to introduce yourself to the patient, and they know that you'll be taking care of them at night. Then you'll sit down, you'll go through their chart, know their orders, know which medications, and know which patient to start seeing. Then after that, I'll just do my normal, passing my meds, doing my assessment, educating patient. Then during my downtime, I'll do my chatting. If I don't do like real-time chatting, because at times it's busy, if you do real-time chatting, then that's it. Then after that, I'll go for my lunch, come back, read, go through my orders, through my meds, and see what needs to be done, such as wound care, all those procedures that needs to be done, blood drawing, and what have you. So just give like an overview how your typical day is when you get to work. After your typical day, you can be asked, what are the common cases you see in the hospital? So from these common cases that you see is where your clinical question will be drawn from most of the time. If you're in med-surg and you ask what are the common things you do, then those are where your question will be drawn. Don't talk about conditions that you don't care of on a daily basis. They're not so common that now when they draw questions from it, it's a surprise for you. So just make sure you just talk about the common condition that you are sure of, and that when asked, you will give an answer to. And then after which they will ask you what are the common procedures you do. Talk about the procedures you do. In med-surg, there are so many procedures such as NG tube placement, catheter placement, wound care. We have the continuous bladder irrigation. Those nurses who are certified do the CAPD. Like, it's a lot of procedures. So just talk about those common procedures and the type and how confident you are to answer them in case they draw the question. Then they'll ask you some of the medication that you give or you use in your unit and how you administer them, ensuring patient safety. So guys, do your research on patient safety, and just to make sure you don't give the wrong medication to the wrong patient, and you give the right dose, the right route, the right patient, the right time. You know the answers. And then you will be asked about the type of assessment that you do. Of course, the head-to-toe assessment, which is the primary assessment, and then later probably you do a focused assessment. In med-surg, if you're a surgical unit, they'll ask you most of the complications of surgeries, and how to overcome them. I'll say about this because I believe I was asked this question, like, what is the importance of early ambulation post-surgery if ordered by a doctor? So you want to talk about that. Another question I was asked was my role as a nurse in patient advocacy. How well would I advocate for a patient? Most of the time you'll be given a scenario, and then you will work out this scenario to see how you come out to advocate for your patient. You will be asked about the type of documentation you are familiar with. Be honest and say the type of documentation that you're using. Back then, when I was doing my interview, I told them we were doing paper chatting, but prior to that, I was working in a private hospital that we were using computer chatting, but it's not similar to this. It's not similar to what you will encounter in the United States of America. The applications are so different, and here the thing is how you draw, like in my hospital, how medication for a patient is dispensed is different, how I chat is different. Like, it is so much advanced and so much computer based compared to when I was home. So when you're not familiar about computer chatting, just tell them, no, I'm not comfortable, or I'm not familiar with computer chatting, but I'm always ready to learn. Always come out as a person who is ready to learn. Like, be open-minded when they're doing that interview, because it's a one-to-one. They read so many things as they're doing the interview with you. Be open to learn. Just tell them, these I'm not sure, but really I'm here open to learn, because it's also a new environment for you. They'll ask you about your educational background. Remember, you have your resume. They're using your resume, like there is a little research they could know about you. And when it comes to educational background, it is what is in the resume that they will use. So this will be regard to where you graduated from, like your nursing school, and then the type of nursing qualifications you have, if you have BSN or diploma, because there's some agency that only take bachelor's holder. And when were you licensed, and any other short courses you've done, and if you're currently in school. Any other courses doesn't just mean short courses, because we have nurses who are certified in a particular area, like renal unit. Some are certified ICU nurses, some are certified med-surg. So it just depends with any other certification you have, because they want to make sure you get the right fit job. And then you'll be asked about your certification. On your certification, the most important one will be the status of your licensure. Remember, you're a nurse, and our profession, you have to be licensed to practice to ensure you are a safe nurse outside there in the hospital. So they want to know if there is any restrictions or not, and if it is current, as I said. They want to know if you have a current ACLS, BLS, or any other certification, those who do pediatric and any other certification. They'll want to know if you have taken NCLEX or no, and if you have taken when and what was the outcome. If it's your first time or you already taken and failed, so that they know how to, deal with you. They're going to ask you if you have IELTS, because there's some nurses who do IELTS before they do NCLEX, and if it is expired or not. Be ready with your clinical questions mostly, because for example, in my clinical question, another question that I was asked was about small bowel obstruction. A patient comes with the obstruction. Just do your research. The goodness of today's era is there's information outside there, and people can connect virtually. You get, let's say you'd be taken with a nursing agency such as O'Grady Payton or Interstar or Evans or whichever nursing agency. You won't be their first candidate. You know that. So reach out to people and ask them, like, how was your interview like? What are some of the questions you are asked? And from that, you can know, or you can have a clue on how your interview might turn out, or how your interview might be like. So just do the questions and just know the area of your specialty. Know some of the common conditions. If you're working in ICU, I don't know what goes in there. I just know the patients are so critical. No, if you're working in med-surg, know about some of the common conditions, some of the common complications, and how to avoid them if they can be avoidable without medical treatment. So guys, tell me about your interview process, because I know most of you are probably been called by this agency and you've done your interview. How was it like? What would you tell somebody? The comment section down here needs to be active, because we need this information. We need to share this information, because there's opportunity here, and nursing shortage is just getting worse by worse in this country. I've made so many videos, and these videos I would want you to watch. If you're looking for a nursing agency, I have a video on direct hire nursing agency recruiting nurses to the United States of America. These agencies work with NCLEX and non-NCLEX persons, and they're a great stepping stone for your dream to come and work in the United States of America. Do apply with so many nursing agencies, then decide on which nursing agency you want to work with. Apply 3 or 4. Direct hire come with so many advantages. The thing with direct hire, why direct hire stands out, or why direct hire is preferable than the nursing staffing agency, is because as a direct hire staff or nurse, your employer is directly going to be the hospital that you're going to. Unlike this nursing agency where they are the middle person or the middle agent or the middle, I don't know, they're in the middle. And with the direct hire, you get the salary. Again, there is advantages and disadvantages of direct hire compared to nursing agency. So again, the video link is right here. Please do click, please do watch. Again, leave me your comments and your thoughts and on the videos you want to see next.